Respiratory syncytial virus, or RSV, is one of the most common and contagious seasonal viruses. It spreads rapidly and primarily affects the lungs and airways. RSV spreads through droplets from coughing, sneezing, or touching contaminated surfaces. Nearly every child is infected with RSV by the age of 2. Immunity is not lifelong, meaning that reinfection can occur at any age. In most cases, RSV feels like a mild cold. However, certain individuals are more vulnerable to severe illness, including newborns and young children, older adults, and people with underlying conditions like COPD, asthma, heart diseases, or diabetes. Symptoms often mimic a common cold: runny nose, congestion, and cough. But in vulnerable groups, RSV can escalate quickly, leading to breathing difficulties, poor feeding in infants, apnea episodes, irritability, or lethargy. RSV can cause serious conditions such as bronchiolitis and pneumonia, and in some cases it may even lead to hospitalization. Every year, RSV leads to approximately 3 million hospitalizations worldwide overall. 1.4 million infants end up in the hospital, and there is on average one hospitalization every 2 minutes among older adults. In a year, 120,000 children under the age of 5 lose their lives to RSV. Severe RSV cases may require hospital care, including oxygen therapy, IV fluids, or even mechanical ventilation to support breathing. RSV is diagnosed using a PCR test in clinical settings. As there's no specific antiviral treatment, current care is supportive. Fortunately, effective immunization products are now available to reduce the impact of RSV infection. For older adults, RSV vaccines are available to reduce the risk of severe RSV disease. For infants, protection is provided either by a maternal vaccine during pregnancy or monoclonal antibodies after birth. How it works. A maternal vaccine stimulates antibody production in the mother, passing protection to the baby before birth. Monoclonal antibodies provide direct protection to infants by giving them ready-made defenses against RSV. All infants whose mother did not get an RSV vaccine can receive them at birth or just before the season begins, often alongside other routine vaccinations. Want to learn more about RSV? Visit resvinet.org and explore our Learning Hub.